Hello, my name is Dr. David Grayson. I am a board-certified hypnotherapist, and I'm here today with Dr. Katie Nordman, a periodontist in Denville, New Jersey, who is going to talk to me about her experiences working on a patient that I've placed in hypnosis. Hi, Dr. Nordman. How are you?
Hello, Dr. Grayson. I'm very good, thank you.
Thank you. That's great. We worked together with one of our patients, and we did several areas of surgery when I put the patient in hypnosis. Could you just give us, tell us what you think, how you felt?
It was wonderful. The patient is a very, very anxious patient to begin with. He has a very bad gag reflex, so I was very anxious myself about doing surgery on him, and it was such a comfort to know that he would be a little bit more relaxed, which would make my life much easier. And basically, as I was working on him, he was so calm and relaxed. He just really allowed me to do what I needed to do without being overly anxious. And even afterwards, when I called him that evening, he had absolutely no discomfort. He was healing fabulously. He had very little bleeding. It just really was a very wonderful experience.
That's great to hear. I know you had told me before we started that you were a little bit concerned how it was going to work out. And I guess from what you're saying, it worked out really well.
Oh, it worked out great. The only thing that I was worried about was being able to talk to him while he was under the hypnotic process, thinking that maybe I would get him out of the hypnosis state, or hypnotic state. But he responded. He was able to talk to me and, move the way I wanted him to without, bringing him back to where we were.
That's really terrific. I like hearing that. Would you say that having him in this relaxed state made you more relaxed?
Absolutely. When patients are very anxious, they seem to transfer that energy to you, so that you might not always work at your best. So when he was so relaxed, and I kind of, as I was doing the whole process and saw that he really was okay, it really made me relax and really be able to focus on what I needed to do.
Which is great for everybody.
Yes.
Did you find it distracting to have me in the room with you?
Not really. It actually was a little bit comforting to know that there was someone else there kind of keeping him focused where he was. And for the most part, it was actually a little bit calming to me too, because I was able to almost see what the patient was, where he was too. I kind of could imagine it. Right.
No, I've heard that before. I think this is great. Do you think that other, either periodontists or other general dentists or really anybody could benefit for something like this?
Absolutely. It just makes, especially with patients that they don't necessarily want to take a medication to relax them prior to, and having to have someone drive them, it just takes all of the guesswork out of it, and they're just so much easier to work with, and the patients are so much comforted by the fact that they'll be out of their hypnotic state and they'll just be off and on their way without any other intervention.
It's always been my thought that that's one of the big advantages of hypnosis. You don't need to bother anyone else. You mentioned healing and bleeding. If you remember, at the end of our procedures, I suggested to the patient each time that he would heal rapidly and easily and have very few, if any, post-operative complications. Of course, there's no way to tell if that actually worked or not. But based on your experience, do you think it helped him heal?
Oh, it was really, really amazing. When I saw him for his first week post-op, his tissue state was so much more, almost more advanced than you would typically see at the first week. Also, everybody's a little bit different. Everybody has a different pain tolerance.
Right.
Some people say they feel, very comfortable afterwards, maybe just a little achy. Just the fact that he felt absolutely nothing was fabulous.
That's great. I'm really glad to hear that. So I guess the impression that I'm getting, and it's probably more than just an impression, that it was an entirely positive experience.
It really was.
That's great. So thanks for you taking your time out of your very busy schedule,
Sure,
and thank you for being here, and thank you for watching.